Let me bring on our guest now. Dr. Imran Noorani, consultant psychologist and assistant professor at Sir Gangaram Hospital is with us. Also with us is Shefali Gulati, professor and faculty in charge at the Child Neurology Division, Department of Pediatrics, AIIMS, New Delhi. Thank you both for joining us. Dr. Gulati, let me come to you first. I know that a lot of doctors through the day that I've been speaking to have been furious, to say the least, at the comments made by Donald Trump. We just laid out the entire research for our audiences also to understand why this is not true. Is there still any doubt or perhaps question in the minds of experts like you that there could be a connection?
I want to clarify for the audience that, autism is not simple. It is a complicated thing. It is caused by some genetic factors, some environmental factors, and some epigenetic factors. And the environmental factors will express the gene, affect the gene expression. Like I'm born with some genes from my mother, some from my dad, right? But my gene expression will be modulated by the environment I am in. Okay, so that is why we have to think about many other environmental factors like air pollution, pesticides, and all, etc., which are not topic of
Air
today.
pollution also, yeah.
There is something called an association, other is called a causality. Whatever many studies are done in which we follow up children and you see, follow up the birth cohorts and try to see, and you compare between those who have developed autism and those who have not, right? Or you may have studies, some in autism and some in not. So they will just show association. Yes, some studies, if you review the literature, have shown association, and they have found some association in few studies of having more autism, and that also autism with hyperactivity in using of paracetamol. Yes, but you have very correctly pointed out to this wonderful Swedish study in which 2.48 million children were taken, and although the initial analysis has suggested an slight increase in autism, ADHD, and intellectual disability, but when they did the sibling control models, they showed no association, and very rightly the exposure is same for siblings, right? So that is indicating that there is some shared familial or genetic factors that might be there. So this is not very simple. So there's so many factors like genetic, epigenetic, environmental, and they are in play. So obviously saying blatantly that the autism has been because of paracetamol is unfounded, and you need more research to understand in that area.
Yeah, you actually need to know how to read the data also. Let me bring in Dr. Imran Noorani over here. So the only thing that matches what Trump has said is the fact that there is some meta-analysis of different studies which was done, which threw up some results. He's basically quoting that, but that's selective quoting, isn't that correct?
Right. So Sonal, science believes in evidence. It doesn't believe in beliefs or belief systems, isn't it? So we have been discussing the etiology or the medical markers, as rightly pointed out by Dr. Shefali, that it is a crosstalk of thousands of genes. And there are some environmental factors which we're not clear right now what exactly causes autism. When you don't know what causes autism, a single drug should not be at the stake that it is the only reason for autism, because scientific studies are always inclusive that anybody taking paracetamol should be having a child with autism then. So it refutes, it's a very premature on part of a political leader like that, claiming at such a huge expanse that it causes autism, because it has a lot to do with the parental psyche. Okay, then once you start pointing at a particular drug, the other aspects of its clinical evaluations, psychological assessments, and the therapeutic interventions, even the medical interventions are defined by the fact that it might be the reason for the same. Because these parents basically are distressed and they want a reason for their problem. And when somebody at this stage gives them an insight that it can be this, so they should not be overkilling with it. What he has done is he has oversimplified science, which is not the thing. We say that science is simple, but oversimplification is not always recommended either. There have been Indian Academy of Pediatrics recommendations are there, which have given the golden guidelines for autism and diagnosis and interventions and the protocols that should be followed. It clearly mentions that there are no medical markers as of now. Second, that therapeutic and medical interventions combined together are the way out for autism. Hyperbaric oxygen therapies, multivitamins, and all those things, they are not recommended either in autism as well.
Got it. Dr. Gulati, let me come to you then. You know, the only thing that is also correct in what Donald Trump said is that the cerebral folate deficiency, which is like a rare genetic deficiency, where folate from the diet, which is essential for the brain development, basically is lacking. And that's where he says that you should give this medicine. Is that also true? Has that worked? Can that correlation be drawn? Or is it too early?
See, there are trials which have shown that folinic acid at doses given from 0.5 to 2 milligram per kg per day can help in some some domains of autism like social interaction and communication and behavior. But the point is with the cerebral folate deficiency, yes, it is a specific precision medicine thing, and otherwise we do have the folate pathway is involved in autism. So this thing can be studied and needs to be studied. But as of now, with the current data, you cannot go and say that that this is the magical cure. And even same thing for like paracetamol. I mean, you have found some studies have found some association. You need to do larger studies to understand, yeah. And by that time, obviously, not to use. I mean, when it is not needed, but when it is needed under doctor supervision, you'll have to take. So this one is not the medicine for all. It has potential role because of the pathway being involved beyond the cerebral folate, the deficiency as well. But then,
Okay.
these are few studies which have done. It'll need much more detailed evaluation in due course
Right.
before you can
You
say
know,
that.
we've talked a lot of science here. We've talked very nerdy stuff as well, but for our audiences whose basic concern is that should we have paracetamol or should we not, I think the verdict is plain and simple. Please ask your doctor. Currently, there is no red flag against paracetamol. Would that be
But
correct to say?
yeah,
And I want to
but
understand from you, Dr. Gulati, as well. Have you got any phone calls from pregnant women since this news is out, checking if this is okay to take or no? I can only imagine the panic that must be going around.
actually, I look after the babies when they come out of the womb, so I'm not getting calls. Yeah, that is one thing. The only thing is, I mean, we have to be clear about the use. We have to use when indicated, not just use for mild febrile feeling and all. One has to rationalize the use of it, yes. And there, I mean, that will be one thing we'll have to be a bit cautious about it. But obviously, talk to the doctors when required. Take right now. There are some studies which are showing associations, but it is not that it will be a red flag right now to do that. It has been a very safe drug over years, but we'll have to be
Kids were studied, 25 years. Now that's a comprehensive report. That gives you conclusive evidence as well. And again, it's coming from countries which have very robust public healthcare systems.
and pathophysiology of autism is pretty complicated, so it's not straight
Yeah.
simple forward maths.
Sure, sure. I want to give the last word very quickly to Dr. Noorani as well now and understand this, that, the only takeaway, frankly, for me on this story, actually two. Number one, don't listen to politicians when it comes to medicine or your health. Okay, ask your doctor. They know best. And number two, the use of paracetamol is still a story to be explored. I think as Indians who explore antibiotics, who exploit a lot of other over-the-counter available drugs as well, Dolo, for example, the one we are popping on our screen right now, we have a habit to pop pills like gems. So this is one thing that is worth discussing.
True. Sonal, as rightly mentioned by Dr. Gulati, as a medical doctor, that this is not something which has been recommended as of now, which is still in trial, okay? And once it comes out, then we will have a clarity about it. But as prima facie is saying, relating autism to paracetamol is not a good psych. I believe that is the way to start with, unless and until we have some recommendations from FDA here in India or the medical regulatory bodies over in India. So as of now, I think psychologically, as a psychologist, we should not be creating any panic around this single drug and autism correlance. Second, we should not be trying immediate outcomes in terms of therapeutics or in terms of medical interventions in autism. As mentioned clearly, that it's a huge spectrum. Every single child that we see in our clinics or in the hospital is absolutely on a different
Yep.
area of it, be it the strengths, be it the weaknesses, and how you experiment it is mostly the interventions in autism are experimental. You work with one child, what a response is there, you make a next plan of
Yeah, no
intervention
one
as per the
size, one
response.
pill for all.
So,
Yeah.
so basically, to give a little psych of some relief to the patient is that right now this is not recommended by any medical body. There is no correlation as of in India or worldwide. So take care, follow the scientific evidences. Evidence-based interventions as given by your medical doctor and the psychologists or the rehabilitation teams that are working with your children. And definitely, the only recommended thing right now is a combination of medical interventions for severe ASD with therapeutic interventions.
Correct. Correct. All right. Thank you both for joining us today on this very, very important discussion. Very quickly, last 30 seconds I have, ma'am.
Yeah, 10 seconds. Vaccination also has no role in causing autism.
Yes.
One should get vaccinated. That's it.
Right.
Yes, that's
Great.
another thing that Trump said. So like I said, 2 takeaways from this story. Number 1, don't listen to politicians, listen to your doctor. Number 2, when it comes to even paracetamol, perhaps the only takeaway all of us need to have is, let's not keep popping pills for every slight pain that you get in your body. Let's try and restrain that. Over-abuse of over-the-counter medicines is anyways a story that India is exploring, and we must do our bit to ensure that we are not harming our bodies any further. Thank you both for joining us on this broadcast.